The missions of our combined internal medicine, preventive medicine residency program and preventive medicine programs are to provide excellent patient highest quality care that is patient-centered, focused on disease prevention and health promotion, to provide superior experience in research and quality improvement, to foster interprofessional collaboration, and to enhance community engagement and advance health equity. At UB, we offer two types of programs. Standalone preventive medicine program, that is 2-year program. We have a combined program that is ACGME accredited as a combined program, internal medicine and preventive medicine program. This program is a 4-year program. First 2 years, the residents rotates and completes most of the requirement for inpatient. Third year is dedicated to accelerated NPH with clinical rotations. And fourth year is basically dedicated to preventive medicine rotations. The IMPM program at UB is unique. The program leadership fosters and develops the passion of the residents and supports the innovations. So these are very distinct at UB.
We are moving towards a model of preventive care, and so this is why preventive medicine becomes even more important. And a lot of the challenges we face at a societal level are tied to issues tied to prevention. So having a program that is very focused on prevention and has a strong prevention component will actually help the community, especially in Buffalo, where we have a very high challenges with equity. And so the idea is that these trainees will actually have a chance to engage the community, provide some level of support to communities that actually need help, do research in the community, and then also provide clinical care. We believe that type of integration will actually address some of the equity issues in Buffalo.
Population health is looking at the health of a group a little bit differently. Medicine tends to look at one-on-one, whereas population health looks at a group together.
Population's health has 4 pillars: chronic disease management, patient safety and quality, health policy, and public health.
When you're working in population health, you tend to talk about things like social determinants of health, the influence of the environment on your health, the differences between behavioral, social, clinical factors on your health. And so it's looking at a broad and large base.
The preventive medicine residents have the opportunity to do rotations that really play to the strengths of Buffalo and Western New York. We have inner-city rotations where there's populations of recent immigrants, of long-standing members of the community, people of all different socioeconomic statuses. There's also the opportunity, very close to Buffalo, to be out in rural areas and see a whole different population and a set of preventive medicine challenges.
This rotations and curriculum in IMPM program prepares them to function as a physician leader in improving healthcare quality, systems of care, and patient-centered approach.
I think preventive medicine program enables those residents to, when they graduate, they know the patient as a whole, which is a huge implement, not only on the patient, but also the whole surrounding of the patient, and we can bring about a change because of that.
As a resident here at the Hurdle Almond Clinic, we are responsible for seeing patients. So our primary responsibility is to address those sorts of problems and to address their chronic medical conditions. There are 2 QI projects that I'm actually involved in at this time. One of them focuses on chronic opioid therapy and reducing the risk of misuse and overdose in patients. The second project I'm involved in is a diabetes project. I think the nice thing about being here at the University of Buffalo is there's very diverse training. You get to see patients in different populations, you get exposure to different communities, and I think it's been pretty rewarding.
One of our new rotations in the preventive medicine residency is the lifestyle medicine rotation. Through both lecture and discussion curriculum, as well as utilizing the American College of Preventive Medicine's formal lifestyle medicine curriculum, you'll get the basics of what to think about when it comes to approaching like behavioral changes and environmental changes to promote health. You also will rotate in different clinical settings. You'll rotate with a preventive cardiologist, you'll rotate with an endocrinologist.
We see patients from patients who never had any cardiac problems to patients who had major myocardial infarction, who has been hospitalized for heart failure. And each one of them would learn how to approach a patient, get a good history and physical examination, the proper testing that needs to be done to these patients, and how to follow them, and eventually the medical management of these patients. Residents, interns that has rotated me, I've been getting very good feedbacks in how they become very comfortable dealing with these patients. They do not feel overwhelmed. And even if they pursue other endeavors, they still learn how to deal with a lot of the simple patients that they come across in their internal medicine patients.
We're very excited about an initiative, strategic initiative started by Great Lakes Health, which is really a community-based quality institute which partners with the healthcare system and really bridges a gap between community, their health, and trust in the healthcare system. So as we think about preventive medicine and we think about healthcare of tomorrow, we have to think about ways of addressing the health of place and having a meaningful dialogue, education, action plan, and discussion on how we can improve that or affect that. The preventive medicine residents that will be trained on all of these quality improvement tools will become leaders in our system around these areas of opportunity and change.
One of the things that I think is a benefit from doing these rotations is that residents get a chance to use the knowledge and skills that they develop during residency in areas like statistics, behavioral health, community health, and epidemiology. And it's a unique opportunity to exercise those skills. And I think another one of the benefits for preventive medicine residents when they rotate through independent health is that they get to see the behind the scenes of a health plan. And you don't really have much of an opportunity to do that otherwise.
We have this relationship with Niagara County Department of Health for 20 years, and we have recently strengthened it to get experience in public health, and they work with various interprofessional health professionals.
The main and best thing about this residency, it's concentration focused. The Masters of Public Health has different disciplines, and you can focus on one that is within the passion that you want.
The biggest gap we have now in the world is sometimes physicians not understanding what the public is going through. What are the common people are going through? What are the gaps? What is the misunderstandings? What are the economics like? What is the funding like? What is insurance looking like? And the fact that we get that perspective is extremely valuable, and I think it can lend itself into anything.
What the MPH degree offers is a population perspective of healthcare and the care that's delivered at outcomes of a whole population. Such a unique program to be able to bring in both of those skill sets in addition to strengthening their interprofessional collaborative practice skills that many students in other programs don't have the opportunity to experience.
Students in our MPH program take core courses in epidemiologic methods, community health behavior, as well as classes related to health services administration in the United States. So we have a core set of classes, and then they also select an individual concentration.
We have a lot of faculty who run clinical trials and interventions here in Buffalo area, sort of could help residents to actually understand the populations they're going to be working with if they're planning to stay in Buffalo, and gain knowledge on a variety of different topics.
One of the strengths of our IMPM combined program is to give students protected time for quality improvement and research, and this protected time is longitudinal.
We have a very strong research base, and we have a large both population health, community health based research. We have a large equity work group on campus. So for someone who wants to do equity, that would be great. We also have a very strong clinical trials program. So again, we have opportunity for people to do different aspects of research. And then across the board, for the kind of things that individuals in preventive medicine would be interested in, UB has a very diverse pool of research opportunities from other departments across the university. So this is really a great place to be.
The Division of Population Health in particular has a number of research opportunities for residents. We have a specific program that's set up in order to offer some conversations. We use papers that have recently been published or books that have recently been published to talk about topics. Then we work with the residents to develop manuscripts, and the Division of Population Health is really set up to help support the residents in that, for everything from designing, the statistical support. We have master's level statisticians that can do that for them, and then helping people write.
There are many rewarding experiences having served in the internal medicine, preventive medicine program, but by far the one that I think sticks out the most is our quality improvement project that we did in our own clinic, where we improved screening rates using non-invasive testing for colorectal cancer. It was real-world data with real-world implementation and real-world results, where we presented at multiple conferences with an oral presentation, but more importantly, we showed significant improvements in our screening rates.
Just recently, I received a Social Injustice Award for making increasing colorectal cancer screening at our clinic.
We need to create the next generation of research faculty. And so having residents start very early gives them a chance to actually get into the nuances of research and really have exposure. Two, it actually creates an avenue for people to actually explore things they may not be interested in right now, but by being engaged, gives them a chance to actually define who they actually want to be down the road. And then three, we actually want to have new ideas, new thought processes. Residents come with a fresh perspective, they challenge the existing paradigm, it gives us a chance to actually have new ways of thinking of the same old problems. So really great opportunity to have trainees. Mentorship is critical because you don't know what you don't know. And having a mentor is actually important because one, they provide insight, they accelerate your training, they shorten the time to getting research results, and they provide guidance and direction for someone who is starting off. So great opportunity for residents.
Medicine is a team sport. Healthcare is a team sport.
All students who go through really any of the medicine programs are trained interprofessionally. Everyone in a Master of Public Health program is also trained interprofessionally. All students will go through a couple of what we call interprofessional education forums.
So when you have a more formal program of training like that, it really reinforces that idea of teamwork, of understanding, of communication, and ultimately this impacts patient care for the good.
The strength of this specific program is how supportive leadership is in tailoring your experience to what you want it to be and to supporting your career goals. And your mentorship and staff and clinical support pours into you more than you would ever expect, so that way you leave much better as a resident than you would have ever hoped or expected. If I ever feel like I need something and I speak up for myself, they do even more than I wanted, more than I ever expected. And the ability to have that level of a relationship with people above you, people who care about you, is something rare in most programs, but is the standard here.
It is important for the residents to gain the experience working with interprofessionals so that when they go out in the community and practice either in the community or within the hospital, they will continue to use those skills and work with a team-based care, interprofessional collaborations in research, quality improvement, and population health. The overall goal of the program is to transform healthcare by creating exceptional physician leaders and to cultivate scientists that are clinicians.
I was always interested in making sure I invest in myself and give myself every opportunity to see as many things as I can before I go out into the world and hopefully try and implement my own change. And this program gave me all those tools and more.